Hey, this is Mike Parton, the President and CEO of Sequatchie Valley Electric Cooperative. For the past 20 years, we've been doing an exciting event called Senior Expos every October. This year, with a lot of events that we know of have been canceled because of the COVID-19 virus. We're going to do something different this year, something that's exciting, something that we think all of you will be very interested in. We're going to be hosting a Virtual Senior Expo throughout the month of October. We invite you to come. We invite you to participate online. Each week we're going to be doing a series of educational videos on all kinds of topics that we think you'll be interested in, just like the in-person Senior Expo. Stay tuned for more details, but again, thank you for being a member of Sequatchie Valley Electric Cooperative. We appreciate our partners and friends at Bledsoe Telephone Cooperative for doing the filming for this event. It's great to have partners like them, but more importantly, it's great to have partners like each and every one of you throughout the many years. Stay tuned. Virtual Senior Expo 2020 is going to be coming to you live.
Hello there, I'm Dr. Greg Phelps, the Medical Director for Alleo Health Systems and Hospice of Chattanooga. I'm here to talk to you today about advanced care planning. But let me tell you a little bit about my own story. I'm a family physician, and my mother got sick with cancer and heart disease and lung disease, and she ended up in hospice. And that was something I didn't know much about at that point, but I was so impressed with the care that she got as she was trying to be kept comfortable towards the end of her life, that I decided this is something I wanted to do. So I left my job as a medical director for a hospital system, and I went to go back and study hospice and palliative care. And now I work for Hospice of Chattanooga. And one of the things I learned when my mother was sick, that it's so important to do advanced care planning. What's advanced care planning? Well, this is an example. This is 5 wishes, and this is a brochure that you can fill out. Now, the nice thing in the state of Tennessee is you don't need a lawyer, you don't need a notary. You can just write out your wishes. You can either use the 5 wishes brochure, or you can go online to advanceddirectivestn.org, and you can get the copy of the state form to fill out your advanced directives. You fill it out, and then you have 2 friends witness it. Now, they shouldn't be people that would be in the will. That looks a little funny, but that you can do your advanced care plan. You know, we say if you fail to plan, you plan to fail. And this is an opportunity for you to make your loved ones understand what your wishes are. It is so important that they understand that they're not trying to make the really hard decisions about what equipment, what medicines, what procedures you would want to have or not have when you're faced with a life-threatening or life-ending illness. So Sequatchie Co-op has a supply of these brochures that you can spend time talking with your family about. Now, there are 2 big dates that we talk about for doing advanced care planning. The first one is April 16th. You may catch the connection, death and taxes. The other one is Thanksgiving, which we in the hospice and palliative care world call Talk Turkey Day. And that's because you're going to be with your family, your friends, good food, and here's a chance for you to talk about what you would want to have happen. This is a gift that you give your family to make known your decisions. And it's not so much this piece of paper, it's good conversation about what's important to you, what matters to you, how do you want to live. It's not so much about the dying, it's about how do you want to live, how do you want to be remembered. And this is a very important part of our care for your patients in hospice and in palliative care, is understanding what matters to the patient. Now, this is a lot to learn. I mentioned I went back to school at the age of 55. This is something doctors sometimes don't know a whole lot about. So it's worthwhile talking with your family, your doctors, about when is it time to be thinking about advanced care planning. In general, we say that you should have this conversation at least 3 times. The first time when you're young and healthy, the second time when you're getting a little older like me and you may have some chronic illnesses, and a third time when you're beginning to face a true life-threatening emergency. At least those 3 times to have that conversation with your loved ones and your family, because it's a gift you give them so they don't have to try to figure it out. Very few things put the fun in dysfunctional, like a family that doesn't know what dad wants when he's in the ICU, and they're trying to figure out what would he want in this case. And this is a lot to learn and a lot to absorb, so it's good to have the conversation several times as life goes forward, illnesses progress, etc. I mentioned that I went back to school at the age of 55 to learn about this because it's such a new area and a new specialty. I actually wrote a book about it called Education of a Hospice Doctor that is my explanation of going back to school at an older age and learning about hospice and end-of-life care. So what we're proposing to you here is through the Sequatchie Valley Co-op, you can get a copy of these 5 wishes and go through them with your family. Now, what do the 5 wishes cover? Well, first of all, who would you want to make healthcare decisions for you if you couldn't? The next one is, what kind of medical treatment would you want or not want? How comfortable do you want to be? Sometimes in hospice we have to balance whether you're wide awake and in some pain or whether you're more sleepy and in less pain. So how comfortable do you want to be? And that varies for every person. Some people have a lot they need to say, and other people say, just keep me comfortable. The next thing is, how do I want people to treat me? And the last wish is, what do I want my loved ones to know about my care? All this is so important as we go through life, to know that life is limited. On every one of our birth certificates is an expiration date. And what we want to know is, how do you want to live your life? How do you want to be remembered? And how do you want to be treated? And with that, I'm going to stop. I thank you for your time and attention. God bless.
Hello, I'm Travis Smith, and I'm a physical therapist with Omni Rehab. Hello everybody. I sure am sad that we can't be together like we usually are for the Senior Expo, but they've asked me to talk with you a little bit about something, and one of the things that I was thinking about was that folks are always asking me about shoulder pain at the Senior Expo in years past. And so I want to just kind of go over some ideas about shoulder pain, some things you can do to know if you have shoulder problems and that sort of thing. So the most common complaint that people have with the shoulder is they struggle with raising their arm above their head. And that's usually in a situation like changing a light bulb or getting something out of a cabinet, getting dishes or glasses out of a cabinet, putting something up on the countertop, those kind of things. Anything that causes you to, or washing your hair is another thing that we'll hear people complain about. Well, there's many reasons why that can happen. And if you have had a bad fall or an accident or a car accident, something like that, then it's very important that you get an X-ray and make sure that that you don't have a fracture. But if there's not been any trauma, you've not fallen down some stairs or something like that, then the most likely thing is a little bit of dysfunction in your rotator cuff. And you've probably heard people talk about the rotator cuff. And I wanted to kind of go into that a little bit today and talk to you about what is the rotator cuff. So when the good Lord designed us, He put a big muscle on the top of our arm called the deltoid. And the deltoid raises your arm up into the air. When it shortens and pulls, it raises your arm up in the air. Well, the problem with that is that you have a little muscle that runs through this little gap in the shoulder blade here called the acromion, and it attaches here. And when you raise your arm and that big deltoid muscle picks it up in the air, it creates a mechanism of pinching here. And what prevents that from happening normally is the rotator cuff. The rotator cuff is a group of muscles that all attach to the head of the arm bone or the humerus, and it attaches to different points on the shoulder blade. When it fires like it's supposed to, when the deltoid is active and starting to pinch, it pulls down on the head of the arm bone so that we get this protective mechanism here, and we're able to raise the arm and keep that space. Now, when that happens, and it continues to happen, and you get this pinching, you'll finally start to wear through the muscle. And when you hear somebody that you go to church with or that you're friends with, and they've said they've had a torn rotator cuff, that's probably what's happened. They've worn through this muscle. And the underside of the acromion starts to get worn as well, and you'll develop a bone spur. And you've probably heard of people having a bone spur in their shoulder, and that's usually what causes it, is that repetitive stress of that kind of bumping underneath the acromion. And so what the doctor would have to do, a surgeon would have to do, is to go in there and actually repair it. And a rotator cuff repair is a very involved procedure where they go in and they will stitch up the tear in the muscle or the tendon, and then they'll also do something called an acromioplasty, where they shave off the underside of the acromion and knock those bone spurs off and free up some more space in there. So what we then they can also, in very severe cases, they may take off the end of the collarbone so that it doesn't crowd that area as well. But hopefully you're hearing this today and we can help you avoid some surgery. So what we want to do is some things to build up the rotator cuff. Now, what most people do when they say, well, I need to do some exercises for my shoulder, is they'll get a little weight and they'll stand and punch that weight up in the air. And they say, well, I'm going to make my arms stronger. But what you're really doing in that situation is you're making your deltoid stronger. Now, if you'll remember what I said a minute ago, the deltoid is kind of the culprit. It's overpowering the rotator cuff. So think about it. Do we want to make the deltoid stronger? No. Let me just answer that for you. No, we don't. So we want to try to make the rotator cuff stronger so it can catch up with the deltoid. So what we're going to do is some exercises with a rubber band is a good way, and we have these at the office that we give to our patients who come to us. But you'll tie the rubber band onto something, and you'll put a towel up under your arm and pull the rubber band away from your body. So you're kind of rotating away from your tummy. Now, you don't want to let it get closer to the floor like this. A lot of folks start to do it like this, or they just start to turn their whole body, or they flap their arm. Those are things we can do to do this wrong. But you keep the arm down, you rotate through, and your hand almost feels like it gets a little bit higher when you do this correctly. It gets a little higher elevation as it rotates through. Then the other thing that you do is you tie it the other way. You tie it onto something over here, and then you pull it to your tummy. So we're working the external rotators, which externally rotates, and the internal rotators, which internally rotate and pull your hand to your tummy. Some other things we do is we want to make sure that your shoulder blades are moving good. So we do a lot of mobility with the shoulders up and down, which is this motion here where you're shrugging, making those shoulder blades move up and down the rib cage, and that gives you that strengthening aspect there. The other thing that we want to do is we want to be able to pull those shoulder blades back together in the back. So we're letting the shoulder blades move in and out on the rib cage. And that helps to make sure that is moving. Because remember, the actual shoulder socket is part of the shoulder blade. So when you hear us talk about scapular or shoulder blade exercises, the reason we're so concerned about that is because we're trying to make sure that we have proper alignment and positioning of that socket, so that we don't irritate the joint through that. Some other things that we can do is to work on the bicep. The bicep's a very important strength stabilizer. So you can get a soup can or a little weight, and you can curl that up like this. We can also work on some wall push-ups. And that's where you put your hands here on the wall, and we do a push-up on the wall, and you can give it a little extra push at the end, and that fires in another shoulder stabilizer called serratus anterior that really likes to fire when you're doing that. If we're wanting to gain some mobility, we would take a towel, and you can put a towel on the wall, and you can slide the towel up the wall, or you can take your fingers and walk up the wall if you're starting to get some pain. When stiffness in your arm. So the main thing to keep to think about is to not let these problems get big. It's like a fire. If you can put the fire out while it's small, usually it's manageable. But if you continue to let this shoulder hurt for months and even years, some people do, we finally end up in a place where the only thing that we can do is a surgical intervention, refer you on to a surgeon. So we don't want to have any of our folks that have to do that. So make sure you talk to your doctor about it, and if they think it's appropriate, we'd love to help you in therapy and help you to resolve those shoulder problems. Thank you very much.
Hi, I'm Tonya Richardson. I am paralegal support for the Pro Bono program with Legal Aid of East Tennessee. I'm really excited to tell you about what Legal Aid does and what kind of services we offer. Legal Aid is a nonprofit law firm. We provide civil legal services to individuals who qualify financially, to individuals 60 and older, and we provide civil legal services to anyone who is experiencing domestic violence. There's a big difference between civil legal matters and criminal matters. When someone is experiencing a criminal matter, the courts are set up to allow an individual who cannot afford representation to have an attorney appointed to them to assist them through the legal process in protecting their innocence. When an individual is having problems with a civil legal matter, these problems can range from small to large, but the really serious problems tend to have to do with your housing. They have to do with safety. They have to do with income maintenance, and that's where legal aid specializes. First of all, our priority being domestic violence and safety, following that with trying to help you maintain your housing and so forth. These attorneys, you cannot have a civil legal attorney appointed to you in these kinds of situations. And these situations can be extremely challenging to navigate through the justice system on your own. We have attorneys that deal specifically and practice specifically in family law and domestic violence. They are the best in the region. When we have matters that arise that are outside of the scope of experience for the attorneys, or our caseload becomes overwhelming, we have what is called the Pro Bono Project. The Pro Bono Project is an amazing project. The really cool thing about it is the partnerships that we're able to form with private practice attorneys in the communities within the counties that we cover. These attorneys volunteer their time to assist individuals in need with their civil legal problems. Areas of practice that legal aid focuses on are housing, family law, benefits and income maintenance, end-of-life preparations, which include wills, living wills, powers of attorney, and conservatorships. The difference between a will and a living will is that a will is your desires for your estate and how you want to provide for your family after you pass. So when you set up a living will, you're setting up ahead of time the choices that you would like to have made for you regarding your medical treatment when you're no longer able to make those decisions yourself. A power of attorney is very different from a will and a living will. A power of attorney is giving someone the power to act in your behalf when you're not able to do that. A power of attorney is something that you give to a trusted loved one to help you take care of bank transactions, help you take care of real estate matters, to help you make other decisions that you need to make when you are incapacitated and you're not able to make those decisions yourself. Legal aid is also able to assist with conservatorships. A conservatorship is different from a power of attorney in that a power of attorney is given to somebody. A conservatorship is something that has to be appointed by the court, typically by order. So conservatorships are very timely. Conservatorships can use a lot of resources, and they can become very expensive for family members who are trying to obtain them to help with your care. Is there a need for a power of attorney if you've named someone on your bank account? This is a really good question. We see this happen a lot, where mom or dad puts a child as a joint owner on their account so that they can conduct their financial business for them. And in theory, it seems like a great idea. However, it can be very dangerous to you. If that individual is sued in court, that account shows up as one of their belongings and therefore would be open to possibly being garnished. And so your money is not safe with having that individual on your account. It's much safer to set up your powers of attorney rather than putting an individual on your account. So if you would like to get a hold of us, if you have any questions or if you feel like we might be able to help you, we would love to speak with you. Our toll-free number is 800-572-7457. If you happen to be outside our service area, we can get you in touch with the individuals who can help you at the other legal aid offices.
Brought to you by Bledsoe Telephone Cooperative, your full-service telecommunications provider right here in the Sequatchie Valley.